Hi, I'm Dr. Connie. So last week I talked about the nuances of living with a chronic condition. This week I became inspired after an encounter with another mom I had met at my son's tennis match. We connected really well and she began talking about her husband, a 4-time Ironman triathlete struggling with chronic pain that is preventing him from doing anything. He's now on antidepressants and pain meds, and he's been to every doctor imaginable and is frustrated and depressed because of his limited physical ability now. Then yesterday, I met another patient who passionately shared her story in the midst of our evaluation. Her story touched me so much that I decided to feature it on today's blog. She'll share her experience as an active woman who, after 2 low back surgeries, is in major pain. She explains how non-invasive surgeries are misleading. The medication she was prescribed caused side effects, and now she's dependent on Cymbalta, which is a medication for anxiety and depression. Most of you know how I feel about the medical system. It's too specialized and ineffective when it comes to health and prevention. Let me be clear that you do need medical services when you have a chronic disease, are sick, or have broken bone, or are in need of some emergency service. But when it comes to your health, I think it's best to stay informed and have a perspective that will ensure the best outcome. I've treated hundreds of patients who opted for surgical intervention only to find themselves either in the same amount or more pain than before surgery. So I'll let Cathy share her story. It's her hope that she helps you make the right decision if you are in a similar situation.
Yes, Cathy Prince-Bloom. I had my first surgery in 2005.
What kind of surgery?
I had a laminectomy of L3, L4, and L5.
Okay.
In Atlanta, Georgia.
Okay. And what preceded that decision to have that surgery?
I had L3, L4, L5, the disc, injured disc. Basically degenerative disc. I lifted up some tile and my back was weak and I was doing a job and it just, they were really bad. I ended up in a pain clinic. When he looked at my x-rays, he was in shock. He said, "Cathy, she's made you worse instead of better." And
the surgeon.
The surgeon. Mm-hmm. And it was only because of the physical therapist that I got any attention or x-rays from the original surgeon. Mm-hmm. And he said, I'm like shocked. He said, but you're probably going to have surgery again because of this original laminectomy. And
how did you feel?
I was devastated. I felt horrible and I was scared. Uh-huh. I thought, I can't go through this again. And I felt it was the worst thing I'd ever done to myself. Mm-hmm. At that point in time, I wanted to tell the world that do not ever have back surgery. You will never be the same, because I was worse instead of better. Mm-hmm. Granted, I felt it was the surgeon's fault in some way, but at that point in time, I had to do something about it because I really was in more pain than I was from the beginning. Mm-hmm. So my daughter-in-law was a medical student at the University of Chicago, and she was working with the surgeon, the neurosurgeon, that was the first doctor that taught how you could do surgery for the back with a laminectomy. Mm-hmm. And he was very famous. Mm-hmm. So she brought him my x-rays, and she talked to him, and he said, she has to have this done right away. Mm-hmm. And so I went to the University of Chicago.
So from Atlanta, you traveled to Chicago.
I traveled to the University of Chicago, uh-huh. And he told me, and it was called non-invasive surgery. Now, non-invasive surgery sounds really great. Uh-huh. Non-invasive surgery is very invasive. Mm-hmm. It's not non-invasive. Mm-hmm. I hate when I see those terms, when I see the commercials on TV. I want to scream.
So
let me get on the web and tell them it's not non-invasive. It's very invasive.
Yeah, and
so I went to him, and he presented himself as a lovely man. He said that, and as a very smart guy, young, and he said, okay, let me tell you, I can help. You have to have what has been done to you. You have to have it fixed. I can fix it, but I can't fix the nerve damage. And there has been a lot of nerve damage. And the nerve damage is very different from the pain.
Uh-huh.
Well, it turned out to be a 5.5 hour surgery, and in a very cold setting at the University of Chicago. And I was absolutely traumatized. And I'm still traumatized with the memory of it, because I was there for 5 days in the hospital.
Is that what you expected?
No.
You thought you were going to be up and
No. I thought I would be up and out, like all the other non-invasive commercials that are on TV.
Yeah, thank you.
And, every time I see one of these non-invasive commercials on TV, I want to tell the whole world, do not ever, ever have back surgery.
Misleading.
It's much worse than not having any surgery at all and finding the right physical therapist. After this procedure, I was given Neurontin. I was given fentanyl patch. Now, I have been anxious my whole life. A type A, personality, very anxious, but I've never been depressed. I not only had an allergic reaction from, we still don't know what, maybe the morphine, I'm not sure. But at the time I was in Chicago, when they let me out, and I was supposed to stay in the hotel for a couple of days and then have another follow-up, I blew up, and I swelled up. They could not figure out what I was allergic to. And they did send me home at that point to Atlanta.
Mm-hmm.
And
you safely got home?
Well, we arrived at 6:30 in the morning, and I went immediately from 6:30 in the morning. At 6:30 in the morning, I was in the dermatologist's office, and who is supposed to be the best in Atlanta. And he met me there, and the last thing a surgeon wants is for you to be on prednisone because it slows the healing.
Absolutely.
Okay.
But he put you on
However,
prednisone?
he had to put me on it. And it helped the swelling. However, I became, for the first time in my life, very depressed. But I was on that fentanyl patch. And I realized that the Neurontin patch, which they had given me, possibly was the cause of this depression. And because it's just not my personality. And you have to be your own doctor today. You really do. I called the psychiatrist that helped me with my sister.
So now you're doing psychiatry.
Okay.
Okay.
And I said, I think I'm dying. And she said, okay, I'm going to put you on Cymbalta. Cymbalta helped tremendously. And I literally got off the fentanyl patch.
And then you started to feel better.
And I started to feel more like Cathy, who I am. I'm still traumatized.
How long ago is that?
So traumatized from that experience. It was 2006.
Oh wow! So
I
it's
know,
over.
it's been a long time.
It's 12. Is that 2006? So 11 years ago.
11 years ago, and once you are depressed, the horror of it is that you never really break. It never breaks. It never goes away.
So for those who are suffering from low back pain, what would you tell them?
I would tell them never, ever, ever have back surgery again. I was referred to a physical therapist that really, I feel like, between getting off the fentanyl patch and having him help me, I feel like he saved me. He was so good, and I was so tiny and weak that I feel like if I had had someone as good as this physical therapist
The first time around.
the first time around, I would never have had to have surgery.
So
He
don't have
moved to
surgery.
Florida. He moved to Florida, and I have to say I was devastated because I felt like he really knew how to treat me. He made me feel strong again. He made me feel like I could have a body, my
He was
body
very
back
encouraging.
again. I believed in him. He believed in me, and he got me back on my feet again.
Okay.
So there you have it. I hope that today's blog gave you some insight on how to best make medical decisions. The best thing to do is to keep your body healthy and strong. Therefore, I encourage you to be proactive in supporting your body. Please subscribe to my channel and/or share this with those who may benefit. Thanks so much for joining me today.